students, as you have followed my MCI FMG exam 2020 August images part 1 recall. So students wanting me to release a second part, so I am releasing this video of images 2020 August FMG recall. So students, I am sharing the screen. Now I am discussing the FMG August 2020 recall images part 2. Part 1 I have already released, as the students were demanding, ma'am please release the part 2 also. So on the request I am releasing. Okay. So whatever questions I've got it from the students, I am just compiling that. Okay. And I am discussing. For the detailed explanation, please refer to the subject specialist. Okay. So the part 2 first image I'm showing, there was an image of a peripheral smear. Image of a peripheral smear. Okay. Most probably taken in a patient presented with malaria, that is high grade fever with chills. And this peripheral smear image shows banana shaped gametocytes. Banana shaped gametocytes. So it is Plasmodium falciparum. Plasmodium falciparum. Next is an image which was asked. There was a question and the Albert staining was given and it was asked which organism is grown. So it is Bacterium Diphtheria. Bacterium Diphtheria. Now third question. There was a patient which was attending the OPD and with a history, 40-year-old, with a history of excessive sleepiness, lethargy, and in the question it was written, he consumes alcohol also. So on examination, the findings were given. This was the image given where you can see there is icterus. Icterus in the eyes, that is jaundice, and there was Dupuytren's contracture, that is in the ring finger. Okay, so according to the options and the image and the history of alcohol consumption, so the answer, there were 4 options. Okay, one was cirrhosis, another was CHF, and 2 more options were given. So the answer to this question was cirrhosis of liver. For the details, please refer to the subject specialist. Now, this was an image and it was psoriatic arthritis. There is psoriasis occurs in the scalp. There is pustular psoriasis. There is gutted psoriasis, and nail finding is very, very typical. There is silvery color scales. Okay, so this arthritis was psoriatic arthritis. Well, you have to differentiate from osteoarthritis, rheumatoid arthritis, etc. Next was a question. 30-year-old female presented with recurrent cough. There is chest pain. There may be history of weight loss, and the chest X-ray was done. And on the blood investigations, the serum calcium levels were as elevated and ACE levels were elevated. ACE, angiotensin converting enzyme levels were elevated, and a chest X-ray was given. So the patient presented with chest complaint, that is chest pain, recurrent cough, and there may be some 2-3 associated complaints must have been written in the question. The students who have sent me this question, whatever information they have sent me, accordingly I have prepared these slides. Okay, so the chest X-ray was done, serum calcium and ACE levels were elevated. So among the tuberculosis, sarcoidosis, you have to select. So this is sarcoidosis, where calcium ACE levels are elevated, and you can see there is bilateral hilar lymphadenopathy. You have to rule out from tuberculosis because calcium levels and ACE levels, they have given. So typically this is a case of sarcoidosis. Sarcoidosis is an inflammatory condition which is involving the lung in about majority of the cases. Then there is skin lesions. Then there may be affection of the heart, other areas, and in the eye there are changes. Okay. So read about sarcoidosis. Many times the question is being asked on sarcoidosis. Next, a patient came with high-grade fever. There are chills, cough with sputum, and there is so much of breathlessness. Okay, and X-ray chest was done. So they have asked it is lower lobe pneumonia, middle lobe pneumonia, and two other options. So if you see, there is middle lobe pneumonia. So answer to this question was middle lobe pneumonia. Another question is 65-year-old presented with high blood pressure 220 by 110 with a history of headache, and the patient was taking antihypertensive very irregularly. Okay, a CT scan was advised, and what does the CT scan image shows? Is it intraventricular bleed, pontine hemorrhage, subarachnoid hemorrhage, or putaminal bleed? So this was putaminal bleed. So details, please refer to the subject specialist. Next, CT scan image was given, and they have asked this marked structure. Okay, so the answer was optic nerve. Next question, identify the marked structure. Okay, these three images was not given, only the one image was given. So when I was selecting the image from the Google, it was difficult for me to find out a single image, so I've just taken this. But in the exam, the three images was not given, only the one image, and this was marked structure was mid-brain. So for this, refer to your radiology or the anatomy. Next, a heart disease patient presented with a chest X-ray and the image showed. So they have given four options. So the answer to this question was, can you see this? This is prosthetic mitral valve because this is in the mitral area. Next, there was a chest X-ray, the X-ray abdomen of a baby, and it is showing pneumoperitoneum. Exact history must have been written in the question, but students have sent me this incomplete history. So this is pneumoperitoneum. You can see so much of air in the peritoneal cavity. That is why this is giving a black shadow. Next, IVP intravenous pyelography, the image of the ureterocele. Image of the ureterocele. Next, there was an image of the elbow joint, and an arrow was marked, and that was capitulum. So please refer to your anatomy. Next, there was an ultrasound image given, and the arrow was marked. So this was portal venous image, portal vein. This ultrasound must have been done in the patient with presented with pain in the right hypochondrium or with the gallstones or something or the other. Ultrasound must have been done in this case, and it showed the image of portal vein. Next, a patient presented with right hypochondrium pain and ultrasound was done. There may be somewhat associated history also. Whenever there is a right hypochondrial pain, you should think of the differential diagnosis. Okay, and the ultrasound image was given. This is typical water lily sign. Friends, I agree that many students are saying the pattern of the paper was difficult, but one thing I want to tell you, whenever there is an clinical question and there is associated chest X-ray or ultrasound or CT scan, the question, if you have a better understanding of the subject, the answers become more easy. Okay. So water lily sign, this is hydrated cyst. Next, a chest X-ray of a patient was done, and this image showed this is hydropneumothorax. Hydropneumothorax. Then there was a case given, a patient of HIV positive presented with fever, dyspnea, cough, CD4 counts were less than 300, X-ray chest was done. And they have asked the 4 options. This is typically a case of miliary tuberculosis. Miliary tuberculosis. This is a very, very spot diagnosis we used to see in the X-rays in the final year MBBS. Next question, acute onset of chest pain, low blood pressure, engorged neck veins, poorly audible heart sounds, X-ray chest was done. Friends, there is a long question which is written and the students are not able to remember the long question. So they just send the main points and I've just collected and made these slides. So it must have been an male presenting with an acute onset of chest pain, low blood pressure. On examination, there is engorged neck veins, poorly audible, heart sounds, and X-ray chest, maybe bedside X-ray must have been done. And I think somewhere I've read that this patient had lung cancer previously. So this clear-cut image, just like this, goes in favor of cardiac tamponade. Causes of cardiac tamponade can be many, that there can be pericardial effusion, which is putting a pressure on the heart. There can be advanced lung cancer. There can be trauma to the chest. Okay. So there can be many more causes for this. Here somewhat it was written that this is a patient of lung cancer. So the answer to this question was cardiac tamponade. So you can very well correlate with the history and to support the investigations are given. Then there was another question. Image of the humerus bone was given and it was marked in the shaft that which nerve is injured. The options given were radial nerve, median nerve, ulnar nerve. So answer to this question is radial nerve. Next, 42-year-old lady presented with post-surgery and came with a follow-up. A chest X-ray was done. Okay, and this is the finding of chest X-ray. Well, the lung parenchyma appears normal. The heart shadow appears normal. And if you see, there is only one shadow of a mammary gland. On the other side, there is no mammary gland shadow. So this is left-sided mastectomy must have been done for breast cancer. Okay, mastectomy done for breast cancer. You can see, you can very well appreciate the margins of the breast. Here there are no such margins. So this is mastectomy being done for breast cancer. Next question, 65-year-old female with a history of fallen down in the bathroom and there was a sustained head injury. Patient was taken to the hospital and a CT scan was done. And it showed, is it an intracranial bleed or extradural hematoma or subdural hematoma? Such kind of image. Okay, when I released a slide of image basis, this was clearly written and this is clearly a subdural hematoma. hematoma. Subdural hematoma, which is just giving a banana shape. When it is lemon sign, lemon type, then that is extradural hemorrhage or extradural hematoma. So, well, in this case, it is subdural hematoma. Next, a patient presented with tingling, numbness, and paresthesias in his lower extremities. MRI scan was done, and it was showing somewhat giving a view of nerve root compression. You have to identify the level. Well, in that question, the vertebral names was not mentioned. Okay, only the arrow was there. So the answer was L4. Nerve root compression at L4 level. Next, a 35-year-old female presented with palpitations, weight loss, tachycardia, and there was an image of the lesions of the anterior side of the leg. So this is pre-tibial myxedema. So options, you have to select between hyperthyroidism or hypothyroidism. So this is hyperthyroidism. Moreover, the history is palpitation, tachycardia, weight loss. Okay, so it correlates with pretibial myxedema, that is hyperthyroidism. Next, 30-year-old presented with road traffic accident, complaints of breathlessness, pulse rate is 110 per minute, blood pressure is 90/60, X-ray chest, bedside must have been done, and the X-ray chest shows this kind of picture. You can see these are the rib fractures. The patient was going in a car and he met with a road traffic accident. He was brought to the casualty with a history of breathlessness. On examination, pulse rate is increased, BP is down. So there may be some bleed in the chest. That is why the BP is down. Chest X-ray was done. And this is typically a rib fracture, that is a flail chest. So what is the management of this case? So patient will have difficulty in breathing. So intubation should be done and positive pressure ventilation should be given. Next, there was an image. This is from anatomy, and they have asked what type of cartilage is this. So this is a secondary cartilage. Next, identify the statistical diagram given. Is it a bargram, histogram, frequency polygram, or scatter diagram? So it is this kind of image is always a histogram. Next, triage under the disaster management color coding from highest to lowest category was mentioned. So this is red, yellow, green, and black. So maximum to minimum. The triage they have asked. Next, there was a pathology question and there was an image which was correlating with multiple myeloma. This is a bone marrow was done. So it is an image showing multiple myeloma. Macrocytes play an important role in phagocytosis with the liver cells. The same function is seen in the liver. Okay, so which liver cells have the same functions? So this is a straight question. Some very, very simple and straight question I have just compiled in the end. That is Kupffer cells. A nurse was taking a blood sample and it was spilled. Now which disinfectant should be used? So 1% sodium hypochlorite. Least iron present in spinach, beans, liver, milk. So answer is milk. WHO deafness in blindness is always remembered 3/60. So that is very, very straight question. Alcoholic patient with neurological symptoms. In alcoholic patient, when there is a neurological symptoms, it is always a vitamin B1 deficiency.